Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada, reporting from Roots Community Health Center in East Oakland for the week of November 30th. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise and give you the information you can use to keep yourself, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to give you our best knowledge and thinking every Tuesday morning of every week. Please submit your questions in direct message or by email to admin@rootsclinic.org. Now, we know that even though this pandemic is worldwide, the effects are different depending where you are. Here in the United States, there are now 13.6 million cases of COVID and 268,000 deaths and counting. COVID is now the third leading cause of death in the United States. It is surpassed only by heart disease and cancer. This is remarkable given that a year ago today we had not even heard about COVID. Now it is the number 3 leading cause of death in the United States for 2020. On Monday, November 30th, there were 7,415 people hospitalized with COVID in the state of California. This surpasses our previous high of 7,170 people hospitalized on July 21st, which was the peak of our surge during the summertime. There are now over 29,000 cases of coronavirus and 512 COVID deaths here in Alameda County. Daily cases continue to climb, as do hospitalizations. Here you can see hospitalizations continuing to increase, heading quickly in the wrong direction. We have not seen this many hospitalizations here in Alameda County since the summertime, and what we're really concerned about here is the rate of the rise of hospitalizations and the fact that we do not know when or where it will peak and come back down. Last month, we were starting to see positivity rates for COVID testing come down across the county and at our site here at Roots Community Health Center. Unfortunately, these rates are going back up again. And as we have seen week after week, East Oakland is hit the hardest. 94621, 94603, and 94601, in that order, are seeing the highest positivity rates in the entire county. And the positivity rates are about triple the county average. The positivity rates for these 3 zip codes ranges from 10% to 12.5%, and this is compared to the county average, which is now at 3.6%. Now I want to share some news from our neighboring county to the south, Santa Clara County. Santa Clara County put new mandatory directives in place from Monday, November 30th through at least December 21st. The mandatory rules may be extended past December 21st. The new rules require travelers coming into Santa Clara County from more than 150 miles away to quarantine for 14 days. There are some exceptions to this, but the point is that these are mandatory travel restrictions being put in place in an adjacent county, the county of Santa Clara, that require 14 days of quarantine if you come to Santa Clara County from more than 150 miles away. They also temporarily prohibit contact sports in the entire county at all levels, and they reduce the number of customers allowed in stores, and they are limiting hotels to only essential travelers. Why? Health officials are monitoring the trends and doing the modeling, and in Santa Clara County, they have determined that if the current trend continues, they will run out of hospital beds and ICU beds. Here in the Bay Area, just 1 month ago, there were 262 people hospitalized with COVID in the Bay Area. And as of this past Friday, that number had nearly tripled to 759 people in the hospital with COVID. And that is why the public health officer in Alameda County, as well as those in Contra Costa County, Marin County, San Francisco County, and the city of Berkeley, have expressed unified support for Santa Clara County's decision, as explained in this joint press release. Alameda County's public health officer, Dr. Nicholas Moss, said, "What we see in the South Bay today, we may see soon across the whole Bay Area. These actions will help slow the spread of COVID in Santa Clara County and beyond." We all know that there are people who work in Santa Clara County and live in Alameda County and vice versa, and who commute on a daily basis. And certainly this virus does not care about our geographic boundaries. I want to applaud Bay Area public health leadership for taking decisive action at the start of the pandemic with the regional shelter-in-place order, and for continuing to lead the way. We hope it will be enough, but of course, it is up to each and every one of us to act responsibly and do what we can in our own spheres of influence. Now, I want to point out that the numbers I've cited today are all pre-holiday weekend numbers. And just this past Sunday alone, over 1 million people passed through United States airports. Beyond that, we are sure that many more gathered for the holidays without taking all of the necessary precautions. All of us in healthcare are bracing ourselves for what could become a surge on top of a surge due to all of this movement and mixing. Now, our testing sites and other testing sites across the county have been seeing demands like never before. In fact, Roots testing site at 99th and East 14th has been testing about double the number of people each day compared to what we were testing on average per day in the month of October. Our positivity rate is also climbing, as it is in the rest of the county, especially for our East Oakland zip codes. I think it is especially important that each and every one of us be conscious of our comings and goings and how we observe the things we know we should: masking, distancing, hand washing, etc. Think back. If you found out today that you were positive for COVID, where do you think that exposure happened? Close contact is defined by the activity you are doing, the type of protective gear you are wearing, and the length of time you were potentially exposed. Now, what do we mean when we say if you were exposed? Our best thinking is that it means being roughly within 6 feet for more than 10 minutes with a person who has COVID-19. How do you know if someone has COVID-19? You don't. You assume that everyone has COVID-19 because we know how many people are asymptomatic or pre-symptomatic. So assume everyone has it, regardless of how well you know them. If they sneeze, cough, sing, or yell, then their droplets are accelerated and they can give you COVID even beyond the 6 feet and in much less than 10 minutes. Actually, they can give it to you instantly. If you have on masks, then the time frame will be longer. But if you are in an enclosed space with someone for long enough, eventually you will be breathing the same air, even with a cloth mask on. Now, we talk a lot about your household and your bubble, but this assumes that you feel reasonably certain about the comings and goings of people in your household or your bubble. Now, I know this is hard, but some of you are living with people who are attending parties or gatherings and who may expose themselves and then you to the virus. Our team has talked to too many people who have gotten this virus and given it to someone else in their household, sometimes an elder and sometimes with devastating consequences. These are hard conversations, but they are conversations you must have within your households, or you need to practice masking and distancing in the common areas of your own home. I've heard some of those testing positive say, "I've been doing so well this entire time and I just went to this one gathering." I hear you, I get it. It has been a long 9 months, but I'm sorry you don't get credit for the time that you did well. It only takes one time to contract this virus. After that, the best thing you can do is not give it to others. Remember, in the absence of a vaccine, the best we can do is mask, distance, test, isolate, and contact trace. So when should you get tested? Here you can see the basic timeline. Day 1 is the day you were exposed. So think back. What day did you come within 6 feet of someone else without a mask? What day did you gather indoors or travel through an airport? This is your potential exposure date. On this day, you have a 0% chance of testing positive, and you also will not have symptoms, but you will very soon be contagious. It's not until about day 5 that most people get symptoms, if they get symptoms at all. Somewhere between day 5 and day 8 is when your test will typically turn positive. This is when you should get tested. And in the meantime, and while you wait for your results, please quarantine yourself, especially from those who are vulnerable. If you do not want to get tested for some reason, please quarantine yourself for 14 days for the safety of those around you. Oakland, I am very concerned for all of us. We are in a surge mode. Cases are increasing rapidly and the rate of rise is very worrisome. Santa Clara County to the south of us has put in some very strict measures for good reason, and we very well could be next. Either way, remember back to March when we first did the shelter in place and when you were washing your hands 20 and 30 times a day and when you were being really careful about staying inside. We are in a worse situation now than we were then. I know that we're tired of it, and I'm especially concerned because of the colder weather that people are starting to want to come indoors and gather there. Don't do it. We are heading into some numbers and a rate of rise that we have not seen before. So this is the time to stay inside if you can. If you have to go out, make it quick. This is not the time to be browsing around, lingering around, or taking longer to do things than absolutely necessary. The only time to go out is to do essential activities. If you are an essential worker or you must do essential activities, those are the only times that you should be going out. And when you do, wear your mask, distance, hand wash, don't touch your face, all of the same advice that you've been hearing over and over and over. This is the time to really redouble your efforts, focus, and stay inside whenever you possibly can. Your safety and the safety of those around you depend on it. The other thing I want to say is that these worrisome trends that we are seeing were all before the holidays. And over the holidays, a lot of you were out there traveling, going to parties. Maybe you limited the number of people, maybe you limited the number of parties, but there were still folks going to parties and gathering indoors, and you know who you are. If you were one of those people, please quarantine yourself. Get tested. Do not go around people who are at risk. They may get sick and do poorly or even die, even though you may be young and healthy and may do just fine. Please take extra care right now because we are at risk of overwhelming our hospitals and not having enough beds. And we saw that happen in other areas of the country, and it was absolutely devastating. We lost healthcare workers and we lost a lot of people. And what we're heading into now looks like it could potentially get much, much worse before it gets better. Thank you for listening. Please join us next Tuesday for the People's Health Briefing. If you have any questions, please put them in the comments, send them through direct message, or email us at admin@rootsclinic.org.